to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Dr. Michael Kachmar. Welcome to Scrubbing Up with Dr. Michael Kachmar. Today's date, Jeremy, just get this camera here fixed a little bit. There you go. Today's date is September the 14th, the year of our Lord 2024 AD. I'm Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. I operate in multiple hospitals. I haven't been operating much because of my shoulder surgery. We've been doing this video podcast probably, 4, 5, 6 years. So this is medical, where medical and political come into play and togetherness. And we, like I said, I'm on multiple staffs, multiple hospitals. I've been a surgeon. I've done trauma surgery. I've done reconstructive foot and ankle. Just to give a little background, I'm still practicing in the Toms River, Ocean and Monmouth County area. We have also with us today Jeremy. Jeremy, you want to say hello?
How you doing, guys? How you doing? Yeah, like Dr. Mike was saying, politics has sort of seeped its way into a lot of different things, including medicine. So our show, we like to always say that it's a, what do you call it? A mixed bag.
Yeah.
Yeah.
We it's impossible since Corona to really keep politics out of medicine. We tried for many years.
Yeah, we did.
In fact, Jeremy will tell you, I had a strict policy, no politics, and we just talk straight medicine.
Yeah, we didn't.
You used to give me a hard time, remember? When we did WOBM.
Because I was like, don't say you don't want to talk about that.
Right. Well, we were with a radio station, and we had to think about their perspective too. I think if we got into politics, they would cringe. But after Corona, and we were silenced. We had our shows canceled. YouTube. People don't realize that.
But the most
people don't. I tell people today, they still don't believe that, or don't know that.
And the most important thing is that the politics affected your business.
Oh yeah.
The lockdowns. Now you've got staff you've got to take care of. You've got your whole practice you've got to take care of because all these little things moved in 6 feet, plastic shields around the desks.
Yeah. But
it was nuts.
the biggest thing, I tell you what, out of all of that, which was terrible, was the infringement on our First Amendment rights.
Yes.
And many doctors, many people around the country, when you do a YouTube video like this, they would just shut you down. They would take it off the air.
They have algorithms too.
You had, with your other shows that you do.
Oh my God!
We weren't crazy. Like I didn't say anything like against the vaccine or anything like that. We were just generally talking about stuff, and any words that came up, they would just cut you off. That's counterintuitive to the First Amendment, and I think people in this country better wise up because they're doing it in England right now. With the what do you call it? It's against the law. I mean, you could get locked up for saying stuff on the internet or posting something. So that's crazy. Anyway, let's talk about today what we're gonna
when your government prevents you from being able to freely express yourself, then there's something
tyranny. It's called
wrong.
Tyranny. You talk about democracy. I tell people, forget about democracy. I think about liberty. And if you take my free speech rights away from me, which was happening in the past 3 years, 4 years, that's my loss of liberty. Yeah. Anyway, let's go to the whiteboard here.
Sovereign American.
Right? I don't even want to get into that. So anyway, this is going to be, I don't want to say controversial, but I learned a lot from this. This is from a book and a podcast. It's called Queering of the American Child, Queer Therapy or Queer Theory.
So what's the definition of queer?
Well, just hang on. Let's just hold. I don't want to give it to you yet. I want to just give me building into it. I want to make some. This is complex. This is on a. If you want to watch this is on American Thought Leaders. It's really a good podcast, and it's called "To Pass as Normal, Kids Must Be Queer." So you understand, part of the definition of being queer is what we would say is anti-normal. So we believe, if you believe, in and I'll give you we'll show these individuals speaking about this, but their opinion is that we're not normal, queer is being normal, and it doesn't have anything to do with being gay. But just hang into that thought. I want to go into that. That this is you could watch this, and we're going to give you some excerpts on here. But from a general standpoint, this is different than my day and back in the days, the 20s and 30s. A lot of gay people were prosecuted. If you were gay, they tried to fix you. So that was considered a psychological disorder. And not you had to be fixed. And they had to basically affirm you. And try to take it away. So in other words, back then, if you were gay, they would put you in these hospitals. They'd get lobotomies, electrodes in your head and all this crazy stuff. Now,
you know what movie this is reminding me of?
Yeah, that Decoder, the one.
No, Clockwork Orange.
Yeah, well, that was no.
Yeah, I mean they were like a subclass, and then they medically tried to change that.
Yeah. Well, the one. So basically, what I'm saying is, back in the day, it was thought that gay was just the way you were thinking. It wasn't inherent. That wasn't your essence, and we could fix it by therapy. And then it got to the point where that was just considered wrong, and we had to affirm it, okay, and embrace it and give whatever you needed to be gay. That's different than what we're talking about now. And this kind of sidesteps into or cascades into gender dysphoria, which used to be, what's the board up there say? It used to be instead
gender identity disorder.
Right. So with the psychology,
about the evolution of the term.
Right. So all the psychology books used to call it gender identity disorder.
Yeah.
And that means it could be fixed. You could do something about it. It's a disorder. Now the definition is gender dysphoria, which needs to be affirmed, not fixed. Affirmed. Big difference. Affirming. What are you going to do? Gender affirming treatment. Psychological help, support, beta blockers, and surgery. So that's how it evolved. Where we're at now. But
now is this all done? This is all done before puberty.
During.
After.
Yeah, during. But I don't want to get into the procedures. But so let me.
No procedures. but gender dysphoria.
Oh, when is a diagnosis made?
It can be corrected by your puberty alone. Refocuses you.
Well, I think that a lot of people want it done before or at the time of puberty. So the medication. So what we're going to do is this. Let's go to what we call the video.
Let's go to the video chain.
Let's go to video. Hang on a second. Let me download this here. Just go to that for me, please.
Okay.
No, go to iPad. Down to iPad. All the way down. Down right there. Yeah. Okay. So we're going to start this, and we're going to listen to this a little bit. Okay, people out there. I'm going to look at the. I have to look at the text here. So here we go. Ready?
Yeah. Let's watch this.
Let's mute it. You got to hit me. Unmute me, please.
I muted you.
Yeah, see on the bottom it says muted. Go over right there. Okay, hang on a second. Let me start it over again. So just go back to me. Hang on.
Yeah,
okay, here we go.
Click big screen too. Where my cursor is.
No, I don't want that yet, Jeremy. Let's just make sure.
It'll make all this disappear.
I don't want it to disappear. I need to do the transcript. Anyway, so just give me a second here. We have to reboot. So we're gonna talk about this. I want to get some sound here for you guys. It's circling. Go back to me until we take care of this, Jeremy. Just go up there, camera. Yeah. So anyway, we're gonna look at this video, and it's pretty important that we look at this. And hang on a second. Let me get everything ready here. We'll try it again. All right, Jeremy, hang on there. Give me 1 second here. Don't tell me it's not going to let me do it now. Hang on.
Well, we always have the transcript to fall back on.
No, we'll get it. I want to hear it.
Yeah.
Okay, go back to me now. We can try it again. Tell me when you're ready.
I'm ready.
All right, let's try it now.
They actually believe that all children are intrinsically queer, and that what's happening is that normal society is socializing them, which is a fancy word for brainwashing them, to be normal, which means for them not queer. where queer is a political stance.
In this episode, I sit down with James Lindsay and Logan Lansing
So just listen
to
to
discuss
this,
their
okay?
new book, The Queering of the American Child, how a new religious cult poisons the minds and bodies of normal kids.
It took me less than 1 minute to find a whole suite of furry literature about children adopting fursonas and identifying not as human, explicitly underwritten by queer theory and the doctrine.
What is queer theory? Who are its biggest proponents? And what practical impact has it had on America's youth, our institutions, and society at large?
There are no brakes on the train. Yesterday's radical.
We'll listen to a
is
few
today's
minutes of this,
conservative.
okay?
It has
Yeah.
to keep moving towards
really
the direction
impressive.
of completely dissolving normalcy, boundaries, legitimacy.
This is American Thought Leaders, and I'm Yanya Kellick.
It's great stuff here. It really is.
Logan Lansing,
Don't touch
James
any of
Lindsay.
that.
Such a
All
pleasure to have you on American Thought Leaders.
Thanks for having us.
Just
Yeah,
don't
I'm
do
glad to be
anything
here.
with those, please.
Let's talk about childhood innocence.
So listen, this is
This
important
is
right here.
something I've been thinking a lot about, something you reference in your book, something that's kind of sacred, I think, in, I hope, most sane societies. Yet, you make the case that this is precisely what's targeted by queer theory, queer pedagogy. Explain that to me.
Yeah, so childhood innocence is targeted by queer theory because fundamentally queer theorists do not believe childhood innocence exists. They think it's what's called a social construct, to be technical. So they don't see anything wrong with targeting childhood innocence because they don't see any barriers there that should prevent them from doing what they're trying to do with children. Actually, at a fundamental level, and we learned this from Eve Kosofsky-Sedgwick, who is a foundational queer theorist, that queer theory sees innocence and initiation as a fundamental binary that must be overcome. So all children are not innocent. All children, from the queer theory perspective, are initiated into some worldview. So innocence, in this respect, is just whatever normal people in society have illegitimately and unjustly and for self-serving purposes defined it to be, so that they can protect children from experiencing the queer that the queer theorists want them to experience, so that they can grow up and turn out a certain way, which is primarily what's called cis heterosexual. So a person who identifies with the sex observed at birth, which they would call
So they don't want that.
sex assigned at birth,
Okay, so,
and
yeah.
with heterosexuality.
And the thing is that
Yeah, listen to this.
queer and gay are not the same. And this is something that has been wildly conflated as well. And maybe, James, you could speak to that.
They actually believe that all children are intrinsically queer, and that what's happening is that normal society is socializing them, which is a fancy word for brainwashing them, to be normal, which means for them not queer, where queer is a political stance. So the word queer is very distinct from being homosexual. In the foundational work where queer is defined as it's used in the word or the term queer theory, this is a book called Saint Foucault, referring to Michel Foucault, the postmodern philosopher. David Halperin wrote, and this is in 1995, a paragraph defining queer. And that paragraph starts with the words, unlike gay identity. And just by the typesetting, it turns out unlike gay identity is in giant, bold, all caps at the beginning of this paragraph. So the first thing on the page in St. Foucault talking about what queer really means is it's not like being gay. If all children are thought to be intrinsically queer, that would include straight children and gay children and anything else that they might imagine. As John Money phrased it on the cover of his most famous book, Gay, Straight, and In Between. So their idea is that unlike gay identity, which is rooted in the positive fact, means something true, of what he calls homosexual object choice, queer is not necessarily based in any positive truth or stable reality. In fact, it's nothing to do with who you are. He says it's defined positionally, which means politically, vis-a-vis the normal. He then goes on and says that it's an identity without an essence, which means it's not essential to who you are. Certainly it's true that men are men and women are women essentially. There is this undeniable biological reality to male and female. It's likely true that some people are homosexual as a matter of essence. It's who they are. We don't know why that's who they are necessarily. Queer is different. It has no essential connection to anything about the person, which means you cannot actually be queer. You can only act queer. It is a political stance. And he says, what's that political stance defined by? And this is his own words. He says it's defined by whatever is opposed. Whatever is opposed to the normal, the legitimate, and the dominant. That's the definition of queer.
That's important to
So it
understand
is a political orientation that is against the idea of normalcy
believe
and
everything
legitimacy in the world. And
we
like I
believe.
said,
Against-
their fundamental
they're against
belief,
everything we
and this
believe,
has come
or
from
that's,
some of the
AP.
activists, one who said it directly on Twitter quite famously some years ago. His name goes by or is named Linds, like part of my last name.
All right, go back to me, Jeremy. That's enough of that.
Yeah,
We're going to go.
that's
So
enough
so
of
let me
that,
go. So
please.
let me make a couple. Yeah, go back to me here. So I want to make a couple points here. So I just followed this, and I, just like a lot of people, didn't. What they just said is basically, it has nothing to do with gay. Because we hear queer, LGBTQ, so this is the Q there. And I have more. We're going to go and just hold your thoughts for a minute. But I just want to make a point here, and then we're going to hit a couple other segments, and then we could discuss it openly. So
Wait, we're gonna hit other segments up that are
Of this-
away
of this.
from this, or
no, the same podcast.
Okay.
So basically, what they're saying here, what I took from that is basically, already they said it's a political stance. Whether or not you agree with this, you got to remember something. I'm not saying I agree or disagree with this stuff. We're pundits. This is our opinion. What the hell do we know? You listen to us, you're in big trouble. But I think that I want to put this out because you could watch this video yourself in entirety, and also understand what these individuals are putting out there and why we have this explosion of people out there, young people, who have identity or gender, whatever you want to call it, dysphoria, disorder. But I just talked to a guy the other day. He's telling me his daughter's, transgender. I mean, it's so many. I mean, every time you turn around, somebody else has a child, who has this issue. And it's impacting the country tremendously. So anyway, I just wanted to pull that out. So did you know that gay and queer are not the same? Or
Well, I thought that. I mean, it's the Q in all those initials.
right? So you thought they're all together.
So yeah, you think it's all grouped together, but see, that's what I've always said that was wrong about those letters, was that I don't believe transgender people belong there. I mean, unless you got the SNP, which, as I've said to my friends and other people,
Then you're serious.
yeah, that's a level of respect that can only be had by a SNP. Okay.
Yeah,
So if you go that far that you feel like you didn't belong in your body, and you're going to make yourself what you want to be, you have all of my respect.
Right.
Yeah.
I agree with you. All right, let's go back now. This is towards the end of the interview. We'll throw this out. I'm sorry. Go ahead, Jeremy. Give me.
But what they were saying about a child's growth, depending upon like they wanna show the child and have him grow in their certain way. But see, coming up as I did in like a suburban family, back in the 80s, I felt like I grew from influences from who I was around, which were my family and my friends. So they want to remove all that and make sure the kids are being raised a certain or are grown a certain way. That differs from the family unit.
Right. I think what you take away from the intro here is that, we believe in, there was heterosexual, man with women, women with men. And then over the years, now we accepted this, that there's gay, that there's.
But it's also
But
your
let me
personality.
finish. But let me finish.
Your
though.
personality
Right.
growth changes with your family unit and all that. I mean, there's a lot of factors in that are so important to me to have made me how I am today.
Right. But let me make my point. Is I'm talking about it from a historical standpoint. What has changed? You had heterosexual. You always had gays. They've been around for ever and ever. And in the turn of the century, we felt that gay was a problem, a disorder, that you felt that you were gay. You really weren't gay. You weren't born that way. You chose to be gay, and we could fix that. And they, with all kinds of therapies and potions, and it turned out not to be the case. You're gay, you're gay. So now you have those two entities that are there, and this is what they're saying. And now you have people saying, well, they're not the normal anymore. We don't consider that the normal. Straight, heterosexual, or homosexual. Now we have this another thing, which is queer, which is a whole nother way of looking at it. And what they're saying is now you're talking about somebody who a man who's gay still thinks he's a man. He doesn't think he's not a man, right? Or somebody who's heterosexual. This is different. So what they're saying is that's what they're saying.
If he's left to be able to think like a man,
right. So what's happening is now. And who's pushing this? Are they thinking this on their own? And let me go finish. Let's finish this next. Go back to my video because you got to listen to this. This is really important. This sums it up here. This is on section 47. Okay, let me start it. Here we go.
So basically, the long and short of it is the reason the mental health outcomes are problems, psychopathologies, trauma,
I want to keep it
that stuff doesn't precede the gender identity.
Listen, this is
that
important.
Is caused because the gender identity is not being included. They don't feel like they belong in the school community. That's been a huge trap that a lot of people have fallen into because many teachers, like we discussed, are empathetic and they want all of their children to feel like they're included and belong. And so when they get a bunch of data thrown at them with these affordance traps and they say, well, clearly there's a disparity here. The children who have adopted a different gender identity than the sex they were assigned at birth or the gender they were assigned at birth have these terrible mental health outcomes. So there must be some discrimination in here we're not accounting for. We need to include more queer theory into the school. We need more inclusive policies. So we see it there.
As opposed to if you were to actually help them with their mental health issue, the situation would resolve.
Right. It's inverting symptom and cause. So rather than saying that, say, a gender identity disorder, as they used to be called, is a symptom of other underlying mental health conditions or a response to previous trauma, which you'll find many people provide tremendous evidence that that's very frequently, not necessarily always, but very frequently what's going on. So rather than saying that gender identity disorder is a symptom of an underlying mental health or trauma-based disorder, they're saying that it is, in fact, that the gender identity disorder is the cause of the other comorbid mental health disorder.
And they're also saying, how dare you say that?
Exactly. Right. And so there's something wrong with you, stupid and evil, particularly, if you disagree.
This is precisely the logic behind the DSM-5 changing in 2013 to classify sex confusion, which is what it really amounts to in children, from being a gender identity disorder, as in a disorder of your identity, something's wrong with the internal processes and you don't really know what you should identify as and you're off track and not normal, to one of gender dysphoria, where we are no longer trying to help you address the root causes of your mental health issues or whatever's causing the sex confusion.
Now, this is truly exquisite what has happened in the DSM. Because
and the DSM, just for the benefit of our audiences, that's
the Diagnostic and Statistical Manual of Psychiatric Disorders. So it is the gold standard book for understanding and diagnosing and recommending treatment for psychiatric disorders. So they literally, in this rewrite for the DSM-5, identify the definition of gender dysphoria, which replaces the previous gender identity disorder, is the distress associated with having a perceived mismatch between sex and gender expression. The disorder itself is the distress. And so the resolution to that is not to treat whatever's underlying cause, as Logan said, but is rather to ameliorate the distress. And the pathway that they've decided is the only way to ameliorate the distress is affirmation. We always hear that, gender affirming care. We have to affirm, we have to celebrate, belonging, inclusion. These are all words that are related, but specifically, the pathway to treatment is given as affirmation, which if this was addiction literature, we'd call enablement. But you have to affirm
Yeah,
That's good. Okay,
that's a
so
good-
go back to me.
Yeah, that was
So-
a great point.
So now, so let me expound on that. So, because everybody, I want to tell our audience, Jeremy didn't know this or see this, so this is all new to him while he's watching, he's processing it. So what I see here is an interesting thing. And again, I'm learning about this myself. I haven't made my decision, but so what I'm seeing here is that, and I think it's different than back in the time with the gays, because I remember people were criticized, but you know what? The funny thing is that my memory, we really didn't, beat up anybody or do anything like that. That wasn't my scene or our scene or anybody I knew of, And I mean, but let me make this point. So what they're saying is basically is that, this gender identity disorder could be treated, and it's caused by something else. In other words, it's not the problem itself. You were traumatized when you were younger. You had some kind of, maybe there's some kind of thing in your brain, but for the most part, we could treat that and you'll get by it. Maybe it's just that you're thinking you're gay, you're gay and you don't know it yet. And because that's my thing. I think a lot of these children are really just having issues with their sexuality and they turn out to be gay, and we're going to put them through, but we engage them down this road of gender dysphoria, and then we start doing surgery on them. So what they're saying is that really, it's, now we've gone beyond that. We're saying this is the disorder and it's causing the discomfort and we have to treat it. And you got to remember, the treatment is basically, surgery and things like that. You need a pen, Jeremy?
No, I forgot what I was going to say.
Okay, that's good. So I just want to make a point here that, we'll finish up and then we could discuss. We only have a couple more segments here. So what they're saying in this segment is basically that the disorder, has been, the psychiatry, psychology, a lot of medical professionals agree with this. What is that this is a gender dysphoria that's inherent. Where it came from, we don't know, and now you need to deal with it. What they're saying is this is generated by queer theory. The queer theory and that whole idea, it's been around for 30 years now, is this is the logical manifestation conclusion walking down the road of queer theory. You follow what I'm saying? So in other words, what's normal is not normal. In other words, heterosexual, homosexual is not normal. Queer is being normal. So they're taking this umbrella term, and that's what they want. The problem with that is, is it really based in science? And you're talking about permanent surgical intervention, okay? And you're talking about children who are under the age of 18, who really, can they make their own, can they consent? Can a 12-year-old really consent? In New Jersey, a 12-year-old could consent to an abortion, which it is most likely very safe surgically. I mean, psychologically, it could be devastating. But, you have an abortion 99.9% of the time, you're okay after that, physically. You're talking about, consent here. You're talking about states taking away parents' children because they won't affirm them. So anyway, let's go to the next thing here. I got another one for you. And let me just get it up here. Let me roll it up here. So just give me a second. Don't put me up yet. So this is a real, I tell you, I've listened to this podcast probably 10 times. And it really tied into me a lot of questions I had, what was really going on. Okay, go back to as we say, the video, Jeremy.
Yeah.
iPad, down, iPad, right there, yeah.
The gender confusion or sex confusion of the child in order to reduce the distress. That's the entire corrupt understanding of this problem that is now gone like an epidemic among young people, especially young girls. You affirm them when they repeat queer theory, and you correct them when they don't repeat queer theory. And so in some sense, you're pulling them in through exploiting their distress, which means that their trauma. You're exploiting that trauma specifically to bring them further along into the doctrine in the name of medical care. It's the only condition in all of psychological medicine. It's the only condition that's treated that way. And the reason is very simple. Why is it this? It's because queer theory has captured not just our schools, but also our professional institutions like the American Psychological Association, which promotes this line relentlessly, the American Psychiatric Association, which is even kind of more strongly devoted to it, American Medical Association. You name the professional organization, the Endocrine Society, they're
heavy hitters,
all
man.
captured, these professional organizations across the board.
The way the American Psychological Association characterizes anything outside of affirmation is conversion therapy. So if you are not affirming the cult identity, which is what it really is, of a child who has significant problems that need to be addressed to help them. That's the most wicked thing about this. These are kids that have been traumatized and they're hurt, there's something wrong, and we need to help them. But all of these organizations are saying, to hell with that. That's conversion therapy, trying to help them resolve those issues. You must, to your point, affirm. You have to affirm.
And multiple states are not just threatening to,
See,
but
this is where it's
literally
interesting when
taking
it comes
away
into the politics.
the children of parents who don't do this. It's not just that states like California and many others have set up as sanctuary states. The case, it's now very famous case of Adam Vina in Los Angeles County.
Just hang on. I want to go to one other here, so just give me a minute here, Jeremy, because I pulled these all out, and they're pretty interesting segments here, and I encourage people. I did this because you could see it here, but people on the podcast, who are not seeing it, they should go and watch it. It's on YouTube video. So let's go here. Okay, here we go.
We really need to pay a lot of attention to detransitioners, and that is because just like someone who may be a Scientologist, you see how difficult it is for them to leave what I believe is the cult they're in. When detransitioners decide to turn away from the doctrine of queer theory, they are viciously attacked. Immediately, their stories are no longer credible. Immediately, they never really felt it on the inside. Immediately, they're a liar. They must be relentlessly attacked and shunned. So we need to support them, because it is with detransitioners that we see that it is wholly unethical and certainly not clinically efficacious to try and get consent at all, let alone informed consent,
and we're going to talk
from
about this.
children before you give them a cascade of puberty blockers, cross-sex hormones, and potentially removing their breast and doing genital surgeries on them. Because we have evidence in detransitioners that they certainly regret it. And they all say the same thing. Where were the adults? I couldn't possibly have given my informed consent. I didn't know anything about sex or sexuality. My mind was still forming. How did you let this happen to me? So I think, briefly, to your point, we need to listen to detransitioners. I think we need to elevate them because they expose the cult dynamics of queer theory. If you listen to them, they talk about the manipulations. They talk about all of the dynamics that kept them in the cult.
So that's another, you could just keep it on this. That's another thing, Jeremy, that's very important. There's a lot of people that are coming out now. They're suing the doctors and the institutions because, they regret it. Now, there's people out there who don't regret it. So, there's a lot of, that's why I'm saying, I'm just throwing this out there. This is extremely controversial in the United States. And this is like really crazy stuff right now. Let me just go to this, finish this up.
The question is, okay, so let's say we have a girl. Maybe it's our friend Chloe Cole. And so at some point, Chloe Cole was 100% convinced that she was a boy. And that was her internal feeling. That was her truth, right? But then now she's 100% convinced, in alignment with physical reality, that she is a girl. One of two things is true. One of the things is that her internal sense of having been a boy during that phase, which she was 100% convinced of, was never veridical. The other is that it's simply not possible to do an accurate diagnosis. There's nothing upon which a diagnosis could be based, because it could later change. And so what you have then is trying to treat what amounts to a psychiatric condition as a physical condition, as something that is rooted in her essence, to be a little specific. But we already heard from David Halperin in the definition of queer that it's an identity. Queer is an identity without an essence. It's not located in the body anywhere. It's not even located in the brain anywhere. So what you have is either they're fundamentally wrong about the nature of gender identity, because Chloe was born female, 100% convinced she was male, at which point everybody was expected to say, well, she's 100% accurate in her own assessment about herself, and then later said, wait, I was wrong, which means the gender identity thing cannot possibly be this kind of concrete thing. It's it's ephemeral, it's mystical or even spiritual. Or if we want to back away from that and say, well, that's not what they're saying in the first place. They're saying that it's, maybe it is a little bit subjective. It's subjective and objective mixed together. And so maybe it could change again later. Or like Logan said, oh, she was just mistaken or lying, in particular lying. Well, then what that means is it's not possible to diagnose it. All you can say is what the DSM has folded and given into is that she's experiencing some kind of distress related to her sense of gender. And they, like I said earlier, inverted symptom and cause in order to justify a treatment. But this is very important because the existence of detransitioners at the very least says it's not possible for these doctors to accurately diagnose a condition meriting permanent treatments like cross-sex hormones, as they're called, or puberty blockers or surgeries, because it cannot be known whether or not it is veridical or non-veridical. There was recently a paper that came out, and
okay, so that's let me make a point there. That's the key, Jeremy. You're doing permanent procedures on these people, and that's what I want to make a point here. I looked at the literature, and this is an interesting article, an interesting podcast, because they're really saying that it's what you feel. And it's not based in, it's different. I want to say it's different than gay and heterosexual. And we're basing. I don't know if we're basing all of this surgery and procedures on sound science. That's my point. I want one more thing, and we'll get out of here. And then you could talk to me about what you think. I know you're, but this stuff is affecting a lot of children, and Okay, so let's just finish here. Let me see, 104. This is the last one here.
Theory train, or as I like to phrase it, queer theory is opposed to limiting principles on principle. And people need to understand that. So to be very blunt about it, will queer theory eventually go into defending pedophiles? Yes, absolutely. Will it eventually go into defending bestiality? Yes. Will it go into any perversion that anybody can possibly think of? Yes. 100% yes. Why? Because it must. Because the second somebody thinks of it and claims that it's essential to their identity, nobody's allowed to tell them no and is a bigot for saying that you draw that line there. You can look now at the way that the radical feminists are being destroyed by the trans activists. By the way. And it's the exact same progression.
Just said that.
Gender criticality went into sex criticality. And there's nothing they can do to stop the train from going to the species criticality. Take, for example, as a very last example, there's a pair of books written by Martine Rothblatt, who is the creator of Sirius XM Radio, therefore a billionaire, sits on the board of the Mayo Clinic now. And these two books are called The Apartheid of Sex, that's the first book. And it explains that the idea that there are men and women is identical to apartheid in South Africa as a moral injustice. But then the second book is From Transgender to Transhuman. It says if it turns out the body's not relevant to who we are in terms of gender, in other words, transgender ideology, then why does it matter what the body is at all? Maybe we could be silicone bodies. Maybe we could be...
enough of this. Okay, so put me back on. So I just want to recap everything here. So what I think that people should watch is, this is on Thought Leaders. It's it's you can get it on YouTube, and I believe the topic of the book is To Pass as Normal, Kids Must Be Queer. It's complex, but it plays into a lot of things that are happening in the United States. But again, I just want to what I understand from this is that the word queer has nothing to do with gay. It's different. And also that if you look over here at our whiteboard, the powers be, the medical society, they used to believe this was a gender identity disorder, okay, which could be fixed, which could be, it's just the way you're thinking, as opposed to now gender dysphoria, which needs to be affirmed and treated. You see what I'm saying? So in other words, once you have gender dysphoria, there's no cure. That's what your essence is, and we have to fix that. Now, and that comes from the queer theory of a logical progression of the queer theory. Now, what they're saying, again, I'm not saying I agree with it. People are going to get all bent out of shape, but what they're saying, which is an interesting concept, they're saying that really there was some kind of trauma, some kind of thing going on. Maybe even, and I've read articles where maybe these kids are gay, just they don't know it yet. They're starting to get those gay feelings, and that they get influenced by other people to say that gay feeling is not necessarily gay. It turns into something. It's more gender dysphoria. That's what they're saying. I'm not saying that happens all the time, but they're
But they're also saying that gender dysphoria may also be gay.
No, well, no, because gender dysphoria is different than gay. You're wrong.
No. Gender dysphoria is a confusion of yourself, your gender, and all of that. Eventually, you're going to make your mind up, and it's either going to be.
No, you missed the point. No, I would be.
How is that? No, Mike. Explain
but that's
that
not what
to me.
they said. No, I'm saying that. No, I'm saying that's not what they're saying. You're missing it. I know.
I'm not talking about what they're saying. I'm talking about what I'm saying. It's a talk show. I'm talking about me.
Oh, okay. So what's your opinion on all this then? I'm sorry.
I think it's too convoluted. I think a lot of these people forget what it was like being a child and going through bodily changes and all of that. I think they've forgotten about mental health. I think they've forgot, and they're talking about children who are either prepubescent or going through puberty. And at that time, they're still too young to be for any of this stuff to be considered. We have to start, and then with the mental health, okay, what are they watching? Because these kids are also incredibly, and you said it, incredibly impressionable. So what are they watching on their tablets? Are we investigating that, or are we just trying to make up some nice sciencey words just to explain this one thing? That's what I'm saying. I think they're forgetting what it was like to be a kid, and they're trying to make a science out of it. And it's being a kid is not a science. It's not. Sometimes you just have to let something be to see what it becomes. But we've created our world differently now. We have tablets and devices that our kids are in their face.
Right.
They're not outside.
Right. So let me ask you this. So
hold on, let me finish my thought.
Yeah, go ahead.
They're not outside playing in the dirt, okay, making forts and pretending this and that, and socially with all their friends out there. A lot of the kids now today are COVID kids. They lived through a lockdown where they were removed from social activities. So the only escape they had were their devices, where they've discovered all of these new ways of being.
Right.
See, that there needs to be.
So that's the cause. You're saying that's causing this.
I think if
they're causing. So these kids watch all of this. They decide that they have gender dysphoria. And then the medical societies will
because even without
the demand. So
even without the devices, all right. When you're growing up and you're going through changes, right? You're trying to figure out who you are.
But Jeremy, let me go back to the whole premise here. Are you okay with the kids in other words, I'm trying to say why are kids saying that they have gender dysphoria? Number one, you're saying
I think they're being told they have gender dysphoria.
Okay, by who?
But these guys, by doctors they're going to or something.
Okay.
Okay.
And why are they saying? And so why are the doctors?
Because the parents nowadays have been watching the same friggin' videos.
Why are the doctors saying that then?
That's the big question.
Okay. Now and why?
Why are they?
Right. And because of gender. So what these guys are saying, because of queer theory, that's been pushed for the past 30 years. Has manifested itself into this thing. Now,
it's all too convoluted.
Now, but it's complicated.
They made a mountain out of a molehill. If you leave these kids, mandate that.
How do you stop? How do you stop
stay on their devices?
Okay, but
get them off of it?
Okay, how do you stop now? The cat's out of the bag. How do you stop all of these medical professional organizations who support gender affirming treatment for gender dysphoria?
Yeah,
how do you change that?
Other medical groups and professionals need to start speaking out against it.
They are.
Mean, this is
they are.
Because this is mental health we're talking about. The choices that they're giving these children. Okay, let's not forget that word, children. All right, these thoughts they're giving them they would not have had otherwise.
Right.
If they're seeing a bunch of other kids during lockdown on Facebook or YouTube, okay. See, a lot of these kids had nothing else to do, so what did they do? They broadcasted and they were daydreaming and they were pretending. So now we're seeing all these people dressing up weird and all of that.
The fuzzy stuff. This is part of queer.
Yeah,
You could be.
but
Describe yourself as an
now
animal.
I'm an impressionable child in a lockdown. My parents aren't even talking to me because we're so over it. Okay.
Right.
And now I've been watching this person and this person and this person. You all have your favorite people on YouTube. Okay.
So you think the internet's a big part of the problem
a
here?
huge part of it. It's a massive part of it because it replaced, Mike, you have to understand this. It replaced going outside and playing in the dirt.
But the lockdown's done now. So we're back outside.
Yeah,
so it's still continuing.
We had a group called Baby Boomers.
Right.
We had Gen Xers.
Right.
This is the COVID kid era. Okay, because how many shootings have we had from kids who were under lockdown and then friggin' snapped?
Yeah, no cursing on us.
Yeah.
We're
I know we're
Christian based here.
We're trying, yeah.
You know, we're going to give you that's purgatory.
I get worked up.
50 years,
But no,
50
you
years in
understand,
purgatory.
We've replaced all that. We replaced playing in the dirt and building forts with devices that take up all your time.
All right,
and impressionable things are being said.
Right.
And they're also being created by adults. All of these freaks and pervs that want to be normalized and they want to entertain children.
So let me
from afar.
Right. So you're against you don't believe that children could give consent at 13, 14 years of age.
No, because if I look back at my age when I was 13, I couldn't tell you two things I was into.
Now, also,
your brain changes over. I'm 50 now. Okay, right. My brain has changed so much over the years, becoming who I am today. I couldn't tell you what I was into, what I thought about at 13. I couldn't tell you. So now put that into these kids. Okay, they're making life-changing decisions.
Sure.
Okay.
So they shouldn't be doing that. That's number one. So let me.
But then again, they have no frame of reference of the future.
Right.
Their future selves and what they're going to be like when they're 50. And look at what they've done that they can't reverse.
So what I tried to do with this,
I'm fighting one thing. I'm not fighting and arguing for these kids today so much as I am for those same kids years from now. But when they find out what they've done and the choices they made were really bad ones and they were too young to be able to make those decisions.
Right. But you have to remember too, what's happening now, where I bring this up, is that there's California, they have laws. There's states that are going one way or the other. Some states are banning gender affirming treatment in anybody under 18. Which I think is a good thing. I think you should wait until 18. I agree that there's gender dysphoria. I'm not agreeing with these guys 100%. I mean, I don't know. There are people who have had gender affirming or surgery, and they're doing very well for many, many years. So it's not as black and white as they say.
But my point is what's the rush? Like if you're 13 and you're thinking about this, why not wait a few years?
Well, according to their position is that, the best time to get is puberty. And what they're trying to do is stop the suicide rate, which is, or discomfort. But let's... Yeah,
I think in doing so, they're going to create another suicide rate.
Right.
Okay? People are going to kill themselves for completely different reasons.
Right. Well, so we think there should be, to be clear, I think we both agree that it should be over 18, and that the parents should have a lot of say in the matter.
I think you should be in your 20s before you make decisions like that.
And because, we're paying for it. A lot of people say, what do you care? Well, I care about human beings, number one. And they say, what do you care about the Kachmar? I care about people and human beings. I don't want to hurt anybody. I don't want anybody to be hurt. And I see this issue as really defining. I'm trying to understand it. I'm trying to understand why these very good people out there who have good intentions, American Psychiatry Association and the endocrine, that they're pushing this or agreeing with this. Mm-hmm. And as a doctor, I sit there. I'm not an endocrinologist, but I'm not a psychiatrist. But I treat thousands and thousands of patients. I just don't see. I can't in my mind understand how they are so damn sure that this is the right way to go. That's the point. And when you're not sure about something, you're talking about, permanent changes here. And, there's a big business. I mean, state of New Jersey, there's an insurance company. I think it's United Healthcare. It's a Medicaid. The state of New Jersey pays for it. There's 15 procedures that they'll pay for gender-affirming surgery that they approve. I mean, they don't approve, some cancer surgeries, or, you try to get something done, a reconstructive thing on your ankle or knee, and we don't cover that. It's not, scientific. But they'll cover 15 gender-affirming treatments that, and you could go on there. They go on, a lot of insurances does. Boston General Hospital, everybody, they're making a lot of money. And then I sit there and go, wow, you wonder, is it taking off? So getting back, but
you also wonder about all of these school systems and teachers that started telling all the kids that everyone's a winner. The kids are walking away with trophies they didn't earn.
Well,
but that puts a child in a mind where it's still affirming that child, and that's
there
what's
you go,
move
affirming,
them in.
and that's what I love. That's what I love about this whole podcast, because it ties everything in. Here's a great example. What this is saying. We believe these people, people who believe in the queer theory also believe in equality of outcome, not equality of opportunity. That equality of outcome. So in other words, if you've got one eye, you're limping, you're a chronic alcoholic, but you want to fly a plane, you should be allowed to fly a plane. So affirming people, minority hires, people who are who maybe not be qualified. So it gets into this whole thing, and that's why I say this is really where I try to understand where this all came from. And
I think strongly that it's just going to end up with the two schools of thought. What we think and what they think. It's up there with pro-life, pro-choice, you name it. I mean, it's just going to be one of those debates. But the crazy thing is that why is nobody thinking about yesterday, as much as I am? I look back at the 80s, right? And if you were to have any kind of thoughts like this, life changed you. Maybe you had somebody biff you upside the head, or some buddies.
Yeah.
But you grew from those experiences. These kids have no experiences.
Yeah.
They've been living off of iPads and
right.
social media for so long.
Right.
They don't even know who they are, so they're desperate to find out what they are.
Right, and it's not. But I tell you what, Jeremy,
we're talking about mental health. I'm talking about mental health.
But people
and what people think about and the progress it gets them to that, the journey that gets them to that, even if they're young. But if they're young and we have all of these people gender affirming them, I mean, if I walk around thinking I'm a superhero and all you're going to do is tell me that, yeah, you are, keep that up. I'm going to keep on thinking I want to be. I want to be
and you crash and burn.
I'm impressionable. I would think that. Wow, they think I'm good at this.
You crash and burn. What's interesting, I do look at history, and I try to make the point here that I think this is different than what happened with gay. Back in the day when I was younger, becoming a doctor, they thought that somebody who's gay, there was a mental disorder.
Yes.
Now we understand that that's not the case, or we believe that's not the case. And being gay doesn't hurt anybody. Also, and there's no surgical intervention. There used to be. They tried to, lobectomies, but
those places, those very same places, have all closed down, and they let everybody out. Why? Because we're affirming the people that were in there that maybe shouldn't have been, but we're also letting loose all the crazy people as well, who now I think fall into a lot of categories in which we're talking today.
Right. Well, but the subtle difference here is this: is that when you talk about history, what the queer theory is saying is that it's very similar to gay. We're saying that it's not a gender identity disorder. Now they're saying it's a gender dysphoria, which is normal, which should be embraced and not treated. It should be treated affirmatively, which means with surgery and beta blockers, as opposed to no surgery, no beta block, no medication, puberty blocker, and and not trying to find out, and give them time and therapy. You see the difference, Jeremy?
Yeah.
So that's the key here. And I think you made a good point, though. Maybe the media has a lot to do with it, but I think it's more.
Certainly does. It certainly does.
And I think, but also here, the big things to take away, I didn't realize, is that it has nothing to do with gay. This is a agenda. Now, this, I didn't read the whole thing here, and we didn't do the whole podcast. But Jeremy, there's also, this is a Marxist, communist, I know it sounds, oh, here goes your conspiracy. But this is based in, if you really want to destroy a society, this is a good way to do it. You know what I'm saying? And have these children who are just, and conflicted with the parents, and the states are getting involved. Look at the stuff that's going on. There's states that are banning gender treatment. There's states that are telling the parents if they don't affirm the kids, they're going to take the kids away from them. So, you have all of this that's going on. So it's a complex scenario. But I think that people should watch this and get their own opinion on it. And it's complex. I had to listen to it about 6-7 times.
I'm on psychiatry.org, okay? And it says, what is gender dysphoria? It says gender dysphoria, which refers to psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity.
Right.
So, but the thing is if
Google what's queer theory. Just try that one too. Right. So basically, what this.
Yeah, but what I'm thinking about that is that why has it been taken away from the psychiatric side of it? Because even the definition says it's a like a mental confusion or
well, it's not a disorder. Yeah, it's dysphoria now. Yeah, they changed it again. It's a subtle change, and I don't know if you appreciate the subtlety, but I do.
What did you want me to look up?
Just queer theory. Just look up the
theory.
But people have to go read this themselves and understand it, and they're going to come back with a lot of different things. It's a subtlety, and it's interesting how there's a lot of people and a lot of institutions who believe this. Bottom line is, young children under 18 are being subjected and could be subjected to surgeries. It's interesting that in Europe they backed off on a lot of these surgeries, and there's been gender treatment, gender surgeries for 50. I know 30 years. 60 Minutes did a study, a show on it. They were in Colorado. There was a doctor out there doing gender surgeries for years, probably back in the 80s and 90s, So it's nothing new. The countries, I think, some of the Middle Eastern countries pay for it and have it done. So, it's been around. It's a complicated thing, but, did you get the definition?
Yeah, queer theory. Now, this is off of Wikipedia, so take it for whatever you want.
Right.
Queer theory is broadly associated with the study and theorization of gender and sexual practices that exist outside of heterosexuality.
That's about a gobbledygook.
It really is. It's just
that sounds like something Kamala Harris would say.
Right.
The purpose of the purpose is to be purposeful, because then there's purpose. But then again, if the purpose was something different, then it would be a different purpose.
Yeah.
But the purpose is always the purpose.
And let me explain what the cloud is. It's a cloud, and all the information goes up there in the cloud.
All right. Let's. How much time? Just put the thing. How much time? How long we've been going? All right, so we're 15. Hey, just do me a favor, Jeremy. Put that up there. Just see what we're streaming on everybody. Go back up there. I want you to, remember I told you just check. Oh, no.
Yeah, no, I know. I'm trying to find what the Chris.
Here. Yeah, hit that right there. The eye, right there. Yeah, just hit there. So I just want to see what we're streaming. Yeah, good. We're streaming. Go all the way down. Now do it again, and just go down. See the bar on the side there, so you see all. There you go. Good. Anyway, let's just talk about one more thing, Jeremy, and that's so anyway, people go look at this. It's called Thought Leaders, and it's great. It's a good book too. I'm trying to read it. So let's just talk. I want to hit real quick before we get out of here. I want to talk about the debate, and I know you're going to have a certain position on the debate.
Yeah.
I want to just give you what I took away from it: the debate between Trump and Harris. And it's probably going to be a little bit different. I mean, I'm not going to focus on, who won or who lost. But here's what I thought she said. I know what Trump says because I watch him all the time. But what was interesting was she said she talked about the war. See, my whole thing about the politics, how I look at politics. you know, the economy, the abortion, you know, First and Second Amendment are very important. But I worry about World War III. I worry about war, and because that could end everything. Everything could be gone because, you know, we all have nuclear weapons. She said a couple things. She said this, and she said that we're going to support Ukraine, whatever it takes. When I hear that, that means support means everything.
The continuance of the war.
Right, and that means,
That's what that
and my
means.
opinion again is I'm a Vietnam. You talk about a baby boom. I got a draft card. I missed the draft by 6 months. They stopped it 6 months prior to when I was eligible to go. I watched on TV 100, a week soldiers died. You know, probably 500 a month. And right now, depends on who you talk to. Robert Kennedy Jr. said about 400,000 troops died over there.
There were so many.
Trump said million. I don't know, but I can tell you right now, hundreds of thousands of Russians and Ukrainians have died. And I believe the only way that whole continue without scrubbing up in Instagram. They shut us off after an hour. You get out of Instagram. I believe this, that there's a good chance if she becomes president that she's going to prosecute the war, continue on with the war, which means. And you know, for her, democracy, whatever, and then there's people on both sides want this, Republican. We're going to need troops. You're going to have to send troops over there. Europe, and us are going to have to send troops. And I can tell you right now, that means there's a good chance the draft is going to come back, and you're going to be taken. And I want people to be how it worked back in my day, okay? Right. And you can say, "Oh, it'll never happen again." I hope I'm wrong, but here's what happens: you get a letter in the mail. And by the way, the last military bill that was passed, everybody who's over 18 in the United States, everybody over 18 is going to be registered now for the draft automatically. Okay, you're going to get a letter in the mail. And here's how it's going to go. You're 18 years old. The letter's going to say, Jeremy Vickers, please report to Fort Sumter.
Dix or
whatever. Fort whatever it is, in 30 days. Now you say, I'm not going. They'll send people to your house and arrest you.
Yeah.
Okay, and you could get 30 years or 20 years in Fort Leavenworth, or you could escape. Maybe go to, I don't know where you could go now. I mean, Canada. I don't know if they'll accept you up there, or down in Mexico. But you got 30 days. Now you report to Fort Dix. Now they shave your head. Right, 6 months. About 6 months. You know where you're at? You're in Ukraine in some crater. Whatever you want to call it. Dig a hole and you're fighting, or wherever else it is. Now, so she said that. So understand, Gen Z, all those people out there, Gen Z, that you may be going, and so that's to me is crazy. Trump said he wants to end the war. Now he won't say how he does it. And
no, but you say, okay, now saying that, Trump said end the war.
Yes.
Kamala Harris said continue the war.
Yes.
Right. The problem I had with all of that, it wasn't clearly, I don't think, presented to us. Trump, for one instance, he was against 3 other people in the room that were rifling off accusations, everything at him.
Right.
Okay.
Right.
So his voice, I don't think, was projecting loud enough. Whereas Kamala, she came out of some cocoon, springs to life, and she's memorizing everything. A lot of it she wrote herself, because you could hear how she was reading it. It sounded like a lawyer. Right.
But what is it?
Writing up their thing.
But what's your point, though? What does that have to do with anything?
My point is that he needs a debate where it's like 2 people interviewing them or giving the questions that are completely impartial or remain that way.
But Jeremy, if you go on the internet, Trump has given 150 so many interviews to everybody. He was interviewed with Elon Musk. So the people want. Here's the thing.
He's been saying it forever.
I'm going to make a point. If everything is going to be based on one friggin' debate that these idiots out there who that's all they watch, then you know what? Fuck them. Let her. Listen. Then kumbaya. Let the 81 million people vote for her again. And I'm just telling them, you're going to get it shoved up your ass because you're going to be drafted. You're going to be in war. And I'll make another point. Let me make one other point. She said another thing. She said about Israel. She's going to push for the two-state resolution, two-state situation. Israel, 90% of the people, I just read an article, are against that. And that means you have to support Hamas and that whole entity. So she said that. Now, again, what's right and wrong, what's the best? But I'm just telling you, she's not going to end that war. She says she's going to get a ceasefire.
When she said that, when she said that, she was completely saying she's going to follow and support Hamas. I mean,
well, but she said she's gonna try to end the war. She didn't. Now again, she's gonna ask for a ceasefire. Biden and her have been doing that for the past, since the war started.
Like you're in office now for a lot of this stuff.
Fix it now.
Fix it now. Fix it now.
Right. Why can't Biden and her negotiate a peace with Putin now?
She's going to lower the price of food and bring down inflation that they created to begin with. How about you do it now?
Right. And I want to
why do I have to wait for you to be president? Are you holding this stuff hostage?
Right. And that's
until you're made president?
And you make a good point. This thing I hear on the internet all the time about gouging, food gouging. Yeah. First of all, why wasn't people gouging when President Trump was president, or even Barack Obama?
Because we were a rich country then.
But people think that they're gonna. I love how stupid people are, and they really are, because we got to start. And or misinformed gouging. Like I have people talk about gasoline. Reason why gasoline is expensive: a barrel of oil cost $80 on the market. Yeah. When Trump was in, he got it down to 40. If Trump could manipulate the markets by producing more oil in this country and pushing it out to the rest of the world, get it down to where it's, say, $50 or $40 a barrel, that's going to, gasoline all across the board, all fuel will go down. That means your airline tickets will be cheaper. The truck that has to deliver the food to the supermarkets will be cheaper. It cascades all the way down.
Our oil reserves were completely filled.
Now
and as soon as they got in, with stimulus checks and all this other bullshit, boom, there it goes.
Listen, I got to tell you this. When Carter was in, President Carter, I was a young person, and that was when we had the Iranian hostages and inflation, and we had gas embargo. Reagan got in and cleaned it up. I mean, it took him a while, but we got energy for any. That's
another president. The other side just ridiculed the entire time he was in.
Right. So so now what's going to happen is, and I tell you my prediction. Like I said, barring those two things I talked about, the war with Harris is crazy. I mean, I would vote not for her just because of her position on the wars. I don't want anybody else to get killed. I don't want to have war. I don't want our soldiers going there. And I don't want to have the draft. The other thing that I could tell you, if Harris gets in, I could see this economy just taking a dumper. And you're going to have the open border. They have their policy is open border. They're democratic socialists / communists. AOC, all of them. If you go on there, you could Google it now. People go look at the
Did you see that
position.
Harris video where she's asked, "Did you have you gone to the border?" And then she answers back, "No, we have gone to the border." And then the interviewer says, "No, have you gone to the border?"
She goes, "I don't have to. I've never been to Europe, and I know how you."
So I've never gone to Europe either.
You know, it'd been good. She could have said, "I stayed at a Holiday Inn," so
and she was the border czar. That was the crazy thing.
But it's not just. You got to understand, it's not just her. It's Biden, and it's the whole group of people around him.
The last thing I want to say about the
interview, the debate.
The debate is that. You called them like stupid and uneducated, and they are, because a lot of liberals and Democrats in the far left.
I would say they're not stupid; they're fools.
They're fools.
I'd rather ship of fools. They're on a ship of fools.
A lot of these people are just regular people.
They're smart. Yeah,
they're
just
lazy, and they read headlines.
Yes,
and they go off on that.
They're not stupid. I should take that back. I'm sorry.
They've been towing their political line without looking up for so long, right? It's just embedded into their minds. So now, we just had this this debate, and all the other side has to do, and they've already done it, and they're playing it over and over again, is collect all the highlights of Kamala Harris where she looked good. And yes, unfortunately, there were several moments where if I'm a Democrat, partially paying attention to it in the background, I'm backing that Harris woman. Yeah. You know, they're going to create like a nice little package out of that. That's what that debate did with those interviewers turning on Trump as they did. He was kind of just stuck in the corner. Meanwhile, all the cameras are on Kamala. You know, all they got to do is wash that up into a highlight reel, and the Democrats are going to eat it up. And now, I feel, there's a very good chance she'll get in. A very good chance. Like, I'm scared.
No, there's no chance.
There's
no chance in hell.
Think so, Mike.
No. Well, you could think that. Listen, I can tell you,
JFK. Let's choose sides then. Like, I'm not a Harris supporter. I'm a Trump supporter. No. But I just feel the way things are going, she might win. You're
based on. Did you think before the debate?
No, but neither did the Democrats.
No. Did you feel that way? I'm talking about you. Did you feel that way before the debate?
No.
Okay, so you're basing it on the debate,
which
right, and so you're no better. So again, I'm not calling you a fool.
No. I'm not saying that I believe this. I believe this. I believe that the Democrats and
but you do believe it because what you believe is that a lot of people are going to be swayed by that. I don't think that is.
I believe in the tricks. Hold on, I believe in the tricks that they've been playing all the way up to date, and they've got and all they're getting is better material. That's it. You know?
Listen, you got to understand the people get information.
The thing about Trump when he was going up against Hillary Clinton, right, is he had his charm and he had his humor. Right. I haven't seen that in him.
Right. I tell you what. And the reason why Trump won the first time in 2016 is because the economy sucked. Barack Obama did a horrible show with the economy. The economy was hurting. We weren't doing well in the stock market, and we were getting hammered out. You know, people were getting their heads chopped off in the Middle East and things like that.
Well, that's where we're at.
So
now.
It was the economy, right? And the economy,
and the people became babies.
Most people out there, I shouldn't call them stupid, but they're foolish. But most people, they're going to vote with their pocketbook, and it's been like that forever and ever and ever. And the economy sucks. They could come out with all the numbers they want. It doesn't matter because I went out to Great Adventure. And hamburger, a milkshake, and a bottle of water cost $36.
Stop.
Yeah, I'm not making. But you know, I mean, you could go on and on. What it costs? Ask people around the country what is their gas prices? I mean, not gasoline, but natural gas. Their electric, their storage and water, their taxes on their house, the car insurance. The insurance companies are like just they everything is crazy right now, and there's a lot of reasons for it. But the big part of it is inflation, and you have that. And she's trying to. I'm going to give $50,000 here. I'm going to do this. But the bottom line is they're not talking about fundamental, especially when she says I'm going to stop gouging. Everybody knows that's not the situation. People who are out there, they know the local markets and everything. They run a low margin.
She also said she's for fracking.
Right. Well, now, so she's going flip flop. I think that now, and I tell you another big thing. One of the reasons why Bush lost, to when with Barack Obama was you had Perot running. Ross Perot was a third party candidate, and he took about 30% of the vote, and it hurt. You have Kennedy now, who I
was a senior in high school.
Kennedy probably would have had 20, 30 million. Who knows how many million people would have voted for him? He's with Trump now, and that's huge. Also, you look at what went on in Twitter, the bullshit assault on our First Amendment rights, and a lot of people are really, even on the left. I'm talking about people who are liberal and middle of the road, and not. Left communists, they stood for First Amendment rights, and that was under assault. I mean, with Twitter, when Elon Musk took it over, he uncovered all the shit that went on. There was all kinds of hearings, and it was proven. Yeah, I mean, it was shit show. And then let's not forget this, Jeremy, that a lot of people, this January 6th, they were all pissed off, but that's been kind of like a lot of it's been debunked. The other thing, Trump was shot, almost, who assassinated, that whole thing.
What really upset me about that was how quickly it all became about Harris immediately afterwards.
Right. That should be still the biggest investigation in the world.
Right.
And he came inches away from having his head blown off.
That picture with his fist up, bloodied face, the American flag behind him.
Right.
I thought he won the election.
Right.
There.
The depends. Again, people are hurting financially. That's one group. The abortion thing. It went to the states. I can't understand how rational people think that's a bad thing, because the founding fathers, right? The whole idea is you want to have federalism. You want to have power, right? Closest to the person.
Right.
If the federal government's making things, I'm not as close as the state. Every state now could decide on abortion, and there's no limit. You could have New Jersey, for example, right? New Jersey right now, this is the law. You could have an abortion up to birth, which means if you're 18, if you're 12 years old, Jeremy, 12-year-old girl, and you're pregnant, and you're healthy,
right,
and the fetus is healthy, you can have an abortion on demand. We have the second most late-term abortion clinics in the United States, and the state of New Jersey may pay for it. Now, that hasn't changed. I mean, somebody was trying to put some legislation in, but, the governor's race, that's going to be coming up. I mean, nobody's running on that in New Jersey. I don't think, so here you have in New Jersey, crazy. I think it should be like 20 weeks or whatever, but my point is that some states are going to go one way, the other states are going to go the other way. Let's just say a state bans abortion all completely, right? Which I think is crazy if they did that. Well, next new governor that comes up, I'll run that for that governor. I'll say, listen, I'll give you abortion until 20 weeks, and I'll be the governor of whatever. You have the ability. So how is that? So she's running on that. So my point is that that's been debunked by a lot of people, and the immigration in this country. Everybody is seeing it. It's 10 million, 15 million, 20 million. How many
of these immigrants can vote, though?
Right. Well, they could try with mail-in ballots. Who knows? There's no control over that. If you don't have to, there's a thing called SAFE Act right now that Congress is trying to pass, which means every state has to ask you for your ID, that you have to show that you're an American citizen. So in New Jersey, you don't have to do that. You could walk in there and vote, or you could send in a ballot. There's no check. There's no ID. You don't have to have an ID. You don't have to show that you're a citizen of the United States. You're not supposed to. You could go to jail. It's against the law. Right. Okay, so there's a lot of things against the law that people do. My point is that do
you remember during COVID? I forget who it was. I think it was Ted Cruz, actually. And he's trying to talk people into getting the jab, getting the injection. And he's like, yeah, and if you do, you'll be able to get a McDonald's hamburger right here. And he starts opening it up and eating it.
Yeah. I
wonder how many, if you can do that and get away with that kind of behavior, and that kind of attempt.
Well, Ted Cruz is a good guy,
I know he is.
Yeah. But a lot of people
my point is with saying that is, who's to say that they're not going to be sending on election day or mail-in ballot day or whatever that starts, a bunch of people going at the tent cities where some of these
there's called ballot harvesting. It's illegal. It's legal in a lot of states.
It's legal.
So
in a lot of states.
But my point about you saying Harris. So I'm looking at all of these things. I'm looking at the assassination, which is still percolating. I'm looking at Kennedy. You have Elon Musk. You have Trump giving and Vance giving interviews on all kinds of different people. And even the super left are starting to come around. It's interesting.
Do you remember the red wave we were supposed to get?
Yeah, we didn't get it.
Yeah.
We didn't get it.
But that's my worry. You're saying, we've got this, and this, and you're right.
Well, people may not show up to
vote.
You
are right. Yeah, but you can't underestimate the laziness of people.
No.
We were begging people, get out there and vote.
Yeah.
This is our chance, and we won the House by the skin of our teeth.
Yeah. Well, Jeremy, here's the deal. People. Have their own agendas. People will vote where they want to vote. I can tell you right now is all the things that Trump said were going to happen, not everything. He said if Biden gets in, the stock market's going to crash. Well, it didn't. It's not. I tell you, a lot of people think it's cranking. It's cranking, but what I read, most people's 401k, their pension plan is back to where it was in 2020. So they really didn't make any money. They're back though, so they're whole. Now, about wars, yeah, we have 2 hot wars, so that came true. Inflation, we got inflation out the butt, so that came true. So a lot of things that Trump did say came true, some things that didn't. Okay.
Him saying now about the jobs and how so many of them are bounce back jobs. People who lost their jobs during COVID, all those nurses and airliners and stuff, they bounced back, got their jobs back, and they're being written down as jobs that the Biden administration and Harris.
They could
created.
listen. They cook numbers for years and years.
It's all of these little things, and I know you always go for the big picture. I always go for the little picture. Okay,
right.
It's all of those little things that they pull the wool over our eyes, or the fog of war, and you don't realize all of this bullshit that they're doing and saying, because not everybody gets their ears in the right place to hear this stuff.
Right. Well, there's a great movie. It's called Doubt, and there's a book called Doubt. So, you're always going to have doubt, and you could talk yourself into one way or the other. I'll tell you this. I think that a lot of people, when Trump was running, said, you know what, I'm going to give Biden a try, and if he doesn't work out, I'm not going to vote. And Biden, was a disgrace, and they weren't going to vote him in. And that's why he's not president now. So you say, well, Harris is somebody different. If they had somebody outside like Newsom or it's totally different, I think that would have been a better play. I think that she's the same old, same old. So my opinion, especially with all the things I mentioned,
she's going to be worse than Biden.
Well, here's the thing, and I'll make another prediction too.
She's going to be worse. Mike.
So yeah, but listen, I'll make another prediction. You say if Harris gets in, democracy will be done. If Trump gets in, democracy will be done. And I don't know what they mean by that. I'll tell you what's going to happen. If Trump gets in, actually, he may be the only person, and he may not be able to do it, but he may be the only person to bring this country together.
Yeah. Oh, I agree.
Okay,
and
the
I
only
believe
one.
That.
She will not bring this country together. In fact, it will divide more. Yeah. And there's another book I've been reading right now at the same time. It's called The Fourth Turning, and basically they say the way to fix, or the way in the past historically how a divided nation gets fixed, and our nation is by either internal, external violence. Which so most likely can be external, a war. Think about it. If she gets in, they prosecute the war in Ukraine, and we have to bring soldiers. They'll make say they push Putin to the point where he disrupts our internet, cuts the cables, or drops a bomb, and then everybody in this country, we got to go after him. Like another 9/11. And they blame it on Putin. So now everybody's gun ho. That'll bring the country together. We're all going to go kill Russians. Problem is they have 7,000 nuclear warheads. And we're going toe-to-toe with them. We're not fighting a proxy now. I mean, we're going toe-to-toe with the Ruskies, which I think is crazy. But anyway, so if she gets in...
But you wonder if he gets in, though, and I'm talking from that devil's advocate left
He can't end it?
No, I'm saying, will him simply being put into office... Because he's making a lot of promises where before he's even... indicted or not indicted.
I think he can, because he's going to have a mandate. The people, but Jeremy,
can he stop the war in that time just by merely being put into office?
Yes, I think so.
You think so?
Yeah.
It's going to change the way Putin thinks, and
They'll
maybe second guess. Let's pull him out.
Yeah. They did it with Reagan. They were shit scared of Reagan. There was let me make a point before I hold that thought.
They're not shit scared of is.
No.
Kamala Harris.
What's going to happen with her is, I think you're going to push towards. There's more chance of having a war. Whether or not a war metastasize in World War III, that's a risk. But that will bring the country together. I would prefer not to be brought back together that way.
Where would the main battleground be? If
Russia and Ukraine on the border right there. It's be hot. That's where it is now.
You don't think it'll stretch out to us?
Well, you don't have to. You could hit us up with take our cable, take our internet out, take our electricity out. I think it's easy to do that. Not easy, but then what do we do? Can you imagine us not having internet?
I'd love it.
Maybe that will solve.
I live off of it. Hold on a second. I live off of it, But I'm aware
But-
that I live off of
Right,
it.
right.
So I would love if it was just shut
But-
down and we could all just be people and be with each other and understand what that's like.
Right.
You
You would, yeah,
know,
but you don't have.
we could be kind for
Right.
a
It would be a
change.
horror show,
we
Jeremy.
could be tolerable
You won't
with
have.
others.
You know what'll happen is you won't have food on the table. You'll be starving to death, and they'll kill each other. You won't have electricity. You won't have. You'll be cold in the winter. You'll be. You talk about eating cats and dogs. You'll be in. You know. So.
I mean,
but
some people are just assholes. I understand that, but look at all the people that have been created within our lifetime. People like Karens, who are effing mental. Okay, we didn't have as many people like that.
yeah. Well, we're divided.
Once upon a time ago.
We're divided. But let me make a point
No,
about.
but a lot of these little things that I talk about, and I know you dismiss a lot of them, but a lot of these little things have created the situation we are in now.
Yeah,
so
yeah,
we weren't thinking about the little things then, and now here we are.
Right, but I just want to let me finish my point. If she gets in or he gets in, it's not going to be in democracy or a republic or liberty. What's going to happen is, you know,
More of the same, if not worse.
it's very clear to me where it's going to go. The borders are going to continue to be open. You're going to have more people coming in here. You're going to have more, you know, the same old shit. It's going to cost us a lot of money for these people. Eventually, she'll close the border down because it's just too much. When they think enough is enough, it's probably at the boiling point now, where they're going to have to start, you know, pushing people out. Barack Obama did this, you know, deported a lot of people.
Do you think
So-
she'll ever visit the border?
Yeah, it doesn't matter. They'll close it.
curious.
I don't care. It doesn't matter to
I
me.
know, but I wanna know
I
what
don't
you
know. I
think.
have no idea. I could care less. It doesn't come into my mind, so I don't even think about it. I think that'll happen is that because there's going to be so much pushback right now, it's just causing so much, you know, a problem. So probably one thing is both of them are probably going to deport a lot of people. I don't know, you know, one way. As far and the other thing is. With Trump, the economy is going to crank. You're going to have money, jobs, the stock market. You're going to go into a significant recession, if not, you know, maybe worse. And the stock market is probably going to start to take a tumble too. So that's going to be the difference there. Deportation will be good. The other thing is with the immigration, and the economy is going to take a dump. But I'm worried. So the immigration, they're probably equal. The economy, there's a absolutely different, you know, no doubt about it. It's going to be crushed. Also, our First and Second Amendment is going to be assaulted assaulted. So your First Amendment, you know, disinformation, all that shit, we will be shut down. What we're doing right now.
She's going to be going right after pro-choice and pro-life.
Right, but
immediately.
Right, but they can't. She ain't gonna be able to do much about that because it's at the states. So that's rhetoric. That's not going to change. You're not going to. That's done. That's just like trying to change.
See, man.
No, that's just
They
like
keep-
trying to change.
They keep saying they
No.
can do something.
Now they could pack the not now. I don't see it. They'd have to pack the courts and do it, and she may do that too. But let me keep on my thought process. So the economy is going to take a dumper. This is where the difference between Trump and her. Trump will support the First and Second Amendment. She will modify it and trash it. Okay. The other thing, the last thing I want to say though is what's the other difference. What is the most important difference is the wars, because she's going to continue on with the Israeli. That war is not going to end because she's not going to let Israel negotiate. I mean, they're not going to go for a two-state solution. Right there, it's just perpetual bullshit. And Ukraine, she wants to support Ukraine because of democracy. That's the difference. And Trump is going to end both of those. How? I don't know. Can he? I believe he can. And also he needs to have a Senate and Congress. So people, got to vote that way. But I tell people, be cautious, because World War III is gone. And you could have millions and hundreds of millions of people die. So think about when you vote. You're emotional about abortion. You're emotional about the border. You're emotional. You should be worried about that shit over there, because that's a hot war, and that's just not a little skirmish. And I think that I'm worried about that. And I've seen Vietnam War, how that escalated. John F. Kennedy wanted to get out of the war. They wanted a couple 100,000 troops. He put in advisors. After a certain amount got killed, he pulled them out. 30 days later, he's dead. Johnson puts in, a couple 100,000 troops. He lost his cool. He lost control of that war. Nixon came in. I remember because I voted for Nixon. It's the first time I voted. He was going to end the war. He never ended it his first term. He put another 500,000 troops. We had, I don't know, 1.5 million troops over there. A lot of, I mean, that was and we, not only what it did to all these soldiers, we killed a ton of friggin'
And then reinforcements
Vietnamese.
came in.
And
we killed a ton of them.
Right, and then you had, the vacuum that was formed. You had the killing fields of Cambodia. 2 million people got killed there by their own people. On and on and on. So my point is that be careful what you wish for here, and it's more complicated. And I know the debate was, to a lot of people, disheartening. But to me, it was just a small snapshot. I learned 2 things from there, and like I said, is about the war. That was what, out of all of that, that's what really lit me up. And there's people on both sides who want that war to continue on. Let me, before we end, just real briefly with the war, just give me 2 brief opinions on the Ukraine-Russian war and the Israeli-Hamas war. Start with Ukraine. Where do you want it to go? What do you want to happen?
Currently, I'd like to see some current video. Like, where is all that? When it first started, we saw everything.
No.
We saw the wasteland the place was. We saw topographical maps. We saw
Of Ukraine, you mean?
Of Ukraine and where all the troops were, and the Russians were, surrounding and all of that. We saw so much, and then complete blackness. We don't know what's actually going on over there, do we?
Well,
not really.
People are telling us, though.
We're just being told what's going on over there.
Right.
Meanwhile, they've got their leader is rich as shit. And he's just laying back. He'll dress up in his fatigue type clothing and go out into the wasteland that his country is, and pretend to lift up a rock and move it. But all he ever did was get rich from this.
Yeah. So you're not in favor of the war?
Oh no.
And what about Israeli? What do you think the solution over there? It's crazy.
As soon as Hamas started riddling babies with bullets, cutting their heads off.
You mean October 7th? Yeah.
I gotta say, Mike, there's no coming back from that. You ever go on a date, right? And you're drinking, and your friends are drinking, and this is your first date with this chick, and you've been dying to get with her, right? And you drank too much, where you're on the
you're sloppy.
The Hershey Park tour ride, which moves at half a mile a second.
You're sloppy.
Or a minute,
I got you.
And you throw up all over yourself. There's no coming back from that, Mike.
Yeah, well, it was pretty
all right, so it's the same thing here. You riddle babies with bullets. I can't see you as being good.
Yeah.
I can only see you as an evil force that needs to be removed. That's what I see. And you know what? How many... We're talking about all these different things, like the queer and gender, the queer dysphagia.
Right.
We're talking about people and how they feel and who they are and identify as. And then, meanwhile, you have the Jews.
They're going to vote for Trump.
Who are being persecuted like they've been throughout history. And nobody's saying, we've got, oh, no. No, you can't do that against the Jewish people, because what more can we do to them that hasn't been already done?
The Orthodox Jews are going to vote for Trump. I don't know about the mainstream Jews, but I think when I read it, and I think there's a difference between the Israeli Jews and the ones who are living here, because they have a different perspective. But what I understand is that two state solution may not be the way to go. I remember Trump, when he was president, he was working on the Abraham Accords, which were still going on. In fact, October 7th, Cory Booker, who's the senator from New Jersey, was in Israel at that day, going there for the Abraham Accords. But they weren't, to me, they didn't seem. But Abraham Accords, just so you know, Saudi Arabia was ready to recognize Israel. We were very close. The world was very close to having a peace deal broker there, and the prince of, or whatever, the king of Saudi Arabia said he would like to make Gaza like Dubai, and have peace, have wealth. So it can be
this two-state idea, right? It doesn't allow for justice or outrage. Okay.
Well, it doesn't allow peace.
doesn't-
It's not going to allow
it's not
peace and
gonna- yeah, but
security.
see,
No,
they're-
security.
They're
Security.
trying to create a security and create a guise of peace
Right.
when it really isn't. You know, but when it gets down to what you did to baby, and there's televised footage
Yeah.
about that, but it was never shown. We're not going to show you the footage. And ever since that day, I thought that was a great mistake.
What's that? What's
Not showing the footage of what they did to those babies.
that? Oh, well. yeah,
Okay,
it's pretty graphic,
because
yeah.
but those of us with a strong stomach or strong temperament should have been allowed to view it with warnings.
Right. But I tell you what, Jeremy.
Subject.
But Jeremy, there's been.
If we had that, it would have opened our eyes up to the evil that's going up there. That we here in this country will have a louder voice because of it.
I don't.
But
I
they
dis-
didn't do that.
I disagree with you. You know why? Because people say it was doctored. It's AI. It's not real. They say it today. So you know. So you.
You know what though?
They say it today,
but my
Jeremy.
point is that's
They
the
still
other
deny-
side. That's the other side that's saying it. So I'm saying for the people who are on our side, and there's some that
They
are,
don't need it.
There's some that are on the line.
People on our side don't need it. You could listen to Douglas.
The lazy ones that are on our side.
Right? Did you listen?
Freaking need
Right.
it.
Let me ask you something. Yeah. Well, that's a good point. Did you listen to Douglas Murray describe? He saw the films.
Did he really?
Yeah, he did multiple podcasts and he discussed it. There's people who saw them, who articulated. But let me just spin back to this. And I just think that in this election that's coming up, there's a lot of hot point issues. And I think that people should, to me, one of the biggest problems or the biggest threats with Kamala Harris versus Trump is the war in Israel and the war in Ukraine. And I don't think anybody is really focusing on that as much. And I understand the immigration is terrible. The economy is terrible, and I think that's what most people are going to focus on, the economy. And remember this, Jeremy, we got about, another 50 days? Anything could happen. From now until then, you could have a terrorist attack. You could have – I worry about Trump, getting another assassination attempt. I mean, if they did it once, maybe somebody will try doing it again. I don't know. And so anything could change.
We also got to get this woman in a situation where she's not on a script or she hasn't memorized.
Forget
the
about
script.
that. You're not going to do that.
No.
It's not going to happen.
Saying,
It ain't going to happen.
I'm talking about the lazy people.
It ain't going to happen.
Need to see what she's really like.
Well, then, you know what? If that's the case, then we're doomed because you're not going to see what she's really
And
like.
You know what completely shocks me is that this isn't a rule. That you, unscripted, have to talk.
Yeah, she's not. They're not. They're gonna.
Because how else are you going to find out? How else am I going to find out about you if I don't see the real you?
Yeah. People obviously.
I
People,
don't want to hear somebody talk about something that somebody else wrote.
Right, but
I want to hear what you have to say with your own words. And if you can't do that, I'm not voting.
right. How many debates did Biden have with Trump? How many times you see Trump out?
And
he
because
won,
of that,
and he won,
it
and he
made
won.
a precedent that she wants.
I understand that, Jeremy, but I'm going to tell you right now, it ain't going to happen. So
No, I know, but I'm just saying. This is my personal outrage.
yeah, you got to push it. Right,
Yeah.
right. That they don't. Well, everything's changed, and you know what? It's all due to that queer theory.
That's where it started. That's
there.
where it started, Mike. Okay.
No, it didn't start there. But I just think that people, hopefully, if anybody hears this or listens to this, that's what I worry about. Because if you have children or grandchildren, they may be fighting in a war and dying. And I ask everybody, like when she said that, democracy in Ukraine, I asked the Gen Z, because they're the ones who are really going to have to fight, are you willing to fight and potentially die for Ukraine? And then fine, if you say yes and you want to prosecute the war, kumbaya, I mean, but and that means, you're going to get drafted. You're going to be, because they're not going to get enough people to volunteer.
What about all these people that?
And the immigrants are going to go too. These illegals, they're going to scap them up. They're going
I'm
to,
talking about,
they're going to draft them, man.
I'm talking about the transgenders. If there's a
could they get
a draft on?
They may.
Yeah, but they're going to be limited to dress code, hair.
Well, they may
all
not.
of that
They may
jazz.
not take them. They may not take them.
Then they should be imprisoned. If you can't fight for your country, right? You need to go somewhere else.
All right. Well, let's finish this. I want to make one more point on that thing. So in Israel proper, in the country, they have about 2 million Orthodox Jews. We call them Hasidic, but they're Orthodox. They wear the hats and the hair, right?
The curls.
They do not fight. They're exempt from war, and they also get a stipend because they study they study the Bible.
They also think they can't pay taxes.
Well, forget about that, but they get subsidized. Now, Israel government came out and says, no, you got to go into you have to fight, no more exemption, and we're also going to maybe stop paying you. Now, which is interesting because that's going to happen here in the United States where we live. There's probably one of the biggest populations of Orthodox Jews. And I wonder how many of them are dual citizens, and I wonder how that would play out in the United States, whether or not they'll get a religious exemption or not.
I'm a dual citizen, you know.
You told me, yeah. But my point is, there's a lot, and it's interesting because right now I don't think we have enough soldiers or enough people that would volunteer for the military. And a lot of these kids may not be able to even get into the past the physical, mental, and all of that. So anyway, let's pack it in. Jeremy, it was a good thing. I hope we made some headways here. Anything you want? Can we tell everybody what we got going on here?
I love what we got. I love our show. I love being able to express our feelings with all of you guys, and we hope you share a lot of what we think. But as we always say,
tell them how to get a hold of us, Jeremy.
This is the start of your education, not the end. Yeah. So research and read. For more information about Dr. Michael Kachmar, please go to Jersey Shore Foot and Leg Center.com. You can also call us.
No, forget about the calling, but just got it. Just go Jersey Shore. It's Dr. Kachmar, drkachmar@comcast.net, Jeremy. So if you want to go to our webpage, it's Jersey Shore Foot and Leg Center. But if you want to send us an email, it's drkachmar@icloud.com.
Right.
Okay. All right, guys. Everybody, have a nice day. Jeremy, let's sign us off. We'll see you next week.
Take care, guys.
Bye-bye.